It's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies and otherwise medically complex patients by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units, reducing the cost of an intensive care bed by 50% whilst providing quality care. In last week's blog, I shared another intensive care at home case study. The case study was intensive care at home nursing services for a medically complex and ventilated toddler, making a seamless transition from hospital to home to free up hospital beds. You can check out last week's episode by clicking on the link below this video. In today's blog, I want to talk about what many families in intensive care want when it comes to end of life for their loved ones. So today's title is One-Way Extubation at Home instead of Intensive Care. After having worked in intensive care for nearly 20 years in 3 different countries, where I also worked as a nurse unit manager in intensive care for over 5 years, I have learned a thing or two about what families in intensive care really want but don't get in intensive care. Some, if not many, patients in intensive care that approach their end of life and are on mechanical ventilation with a breathing tube or an endotracheal tube will need to be extubated, which is the removal of the breathing tube or endotracheal tube at some point. Once those patients have the breathing tube or endotracheal tube removed and are disconnected from the ventilator, they will inevitably approach their end of life because of their incurable and life-limiting critical illness. This is often a rather confronting, unpleasant and undignified procedure, especially in the confines of a sterile intensive care environment. Not only do families of critically ill patients in intensive care need to come to terms with the imminent passing of their loved ones, they also don't get given a choice where this one-way extubation and, in essence, end-of-life situation will take place. Many, if not most families in intensive care would like this one-way extubation to be performed at home rather than in intensive care. Well, this is certainly what I learned in nearly 20 years intensive care nursing experience. It also makes perfect sense simply because families in intensive care want to make informed decisions. They want peace of mind. They want to have control, power, and influence. Furthermore, 75% of people in first world countries want to die at home, and yet less than 15% actually do approach their end of life at home. Therefore, there is a total mismatch in what people want and what they'll get when it comes to end-of-life situations in intensive care. In fact, I have written an article and made a video about this very topic with the title, Do Intensive Care Units Have a One-Size-Fits-All Approach When It Comes to Dying? And I put a link to that video and article below this video. A service like intensive care at home can support families in intensive care getting what they want when it comes to end-of-life situations for one-way extubations at home rather than in intensive care. In fact, intensive care at home can provide one-way extubation services at home. If people don't want their loved ones to die at home, that's fine as well. However, we do need to give people choice in a first world country. We, as intensive care professionals, also need to be more compassionate and empathetic towards families in intensive care and give them what they want when it comes to one-way extubations in intensive care, by giving them the option to have their loved one extubated at home when it comes to end of life. End of life in intensive care when it comes to one-way extubation cannot be a one-size-fits-all approach. Thank you for watching. If you want to find out how we can help you to get your loved one out of intensive care, including palliative care or long-term acute care, also out of a nursing home, or if you find that you have insufficient support for your loved one at home on a ventilator, if you want to know how to get funding for our services, or if you have any questions, please send me an email to patrick@intensivecareathome.com or call me on one of the numbers on the top of the website. My email is patrick@intensivecareathome.com. That's Patrick just with a K at the end, no C. Also, please have a look at our career section. We are currently hiring ICU and pediatric ICU nurses for our clients in the Melbourne metropolitan area and in South Gippsland, Victoria. We are an NDIS, TAC and DVA approved community service provider in Australia. You can also have a look at our range of full service provisions by clicking on our services tab, and you can also find case studies on our website. We have also been part of the Royal Melbourne Health Accelerator program for innovative healthcare companies last year. Thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll see you again next week in another update.